Thank you all for being here with us today to talk about Inside the COVID Unit, Battling the Coronavirus Pandemic in Miami, a 5-part Miami Herald McClatchy documentary series that tells the stories of frontline workers, their patients, and their families in the coronavirus pandemic as it struck Florida in 2020. Director Reshma Kirpalani has been the driving force behind this documentary. She began this project with a simple question last spring to Jackson Health System, Miami-Dade County's public health system. Would they allow her inside one of the county's public hospitals so she could follow frontline workers as they fought the coronavirus pandemic? Doctors and nurses at Jackson South agreed to help her, and they began filming too. Months of collaboration grew into this 5-part series that pulls back the curtain on what was going on inside the COVID unit. Reshma is here with us today.
Hello.
Also with us, Dr. Andrew Pastevsky, the ICU medical director at Jackson South, who started treating COVID-19 patients in the earliest days of the pandemic. A critical care doctor and pulmonologist, he'd only been the ICU chief for about a month when the virus struck South Florida in 2020.
Hi, how are you?
And Julio Valido, a registered nurse who began working with COVID patients at Jackson South the first day that a patient with symptoms of the virus came through the doors. He'd been an EMT paramedic before he became a nurse. He said he chose to work with COVID patients in part because at 32, he was younger than some of the nurses who might have been at greater risk if they came in contact with an infected person. But this is also a story about the effects of the pandemic on the families of healthcare workers. Joining us today are Melinda Lee, Dr. Andrew Pastevsky's wife, and and Elizabeth Valido, Julio Valido's wife. They graciously allowed us into their daily lives so we could show the audience the sacrifices made by frontline workers, as well as their families, to save lives of COVID patients. We'd like this to be a conversation, so please jump in if there's something you'd like to say. In a moment, I'll direct a question to all of you about the filming of the documentary, but first I'd like to ask Elizabeth the question. We understand you have just recently been exposed to COVID in your job as a teacher. You're currently at home quarantining. Can you tell us how you're doing and how you're feeling?
I'm doing fine. I thankfully, I got tested yesterday just to be safe, but I don't think I'm going to be positive, but I'm doing okay. I'm doing the best that I can. It was at the end of the day when I was about to leave, so I didn't really get to pick up many resources, but we're doing the best we can. And with a bunch of kindergarteners, it's kind of difficult, but we're getting through it.
And you're waiting on your test results? Is that the situation?
I am. I got tested yesterday in the afternoon.
So you can learn as soon as today?
I hope so. Yeah.
Well, let's move on to the process of filming this documentary. This is a question for all 4 of you, starting with Andrew. Can you tell us why you agreed to be part of this project? What did you think it would accomplish? And I'd like to note this is the first time we've had a chance to catch up with everyone since we finished filming. Some of you have never even been in the same virtual room together, so we appreciate you coming together today. Andrew, why did you decide to help the documentary, and what did you hope that it would accomplish?
So I agreed to do the documentary mostly because I felt that the work going on in the background by the doctors, the nurses, the respiratory therapists, all the other workers was not really getting recognized properly. And I was very proud of the way my administration started to tackle COVID with all of the people supporting us, specifically dietary, and I felt like they needed to have their story told. And we're part of a big system, but we all often get shadowed by the Jackson Memorial, and there are some amazing people here that I felt deserved to get recognized for their efforts.
And it was very early on in the pandemic when you were agreeing to do this, so you perhaps did not know how long of a project you were signing up for.
Oh, no, it wasn't supposed to be anywhere near as long of a project in any way, shape, or form. It was supposed to be about a month of work, which my wife agreed to, and it became about 6 months of work, which my wife was not agreeing to. But fortunately, she was a good sport, and the end result speaks for itself because it really does capture fairly accurately what we've had to go through and the severe surge that we had to deal with.
Julio, would you discuss a little bit from your point of view why you agreed to do this? How did you become involved in this project, and what did you want people to know about it?
Well, I learned about the project through Rishma. Andrew completely forgot to tell me that he volunteered me for it. So it was kind of a surprise when when Rishma called me. I'm sorry. But as the project like came along, it was really cool to see, like, how we incorporated, like Andrew said, all the people that are getting overlooked. Doctors and nurses are just one aspect of this whole thing. It's mainly everybody in the hospital that's really working towards keeping us safe and keeping everything clean. Respiratory, dietary, the people that clean it. I mean, it's a full group effort. So it's really cool to see, how everybody has been getting involved and make sure that we stay safe.
And Melinda, your husband mentioned that you were not particularly interested in the longer term project that we did, but I think in the end you were pleased with it. Could you tell us what your thought process was there?
Sure. So I'm actually a very shy and conservative person. So to put our lives on TV, I was a little bit anxious about, but in the end, I'm just very grateful to be able to share with everyone our experiences with the pandemic, and to provide a little bit of our experiences and to educate everyone on, our experiences with the pandemic. So I am, even though it took a little bit longer, it did, how to say it, it did give a good representation of everything that we went through.
And Elizabeth, what did you believe you were going to be doing with this project, and how did that turn out for you?
I laugh because this was actually like a thing that Reshma and I had the entire time. I never get a lot of information from Julio. He always gives me this much, and she kind of fills the gap. So I thought this was like a one-time thing. I thought we were going to be interviewed one time, and it was going to go in an article online. And I never imagined that this was what it ended up being. And I'm pleasantly surprised, and I'm so thankful that we got to share our side of it as the family, because I think no one really thinks about that sometimes. It's amazing what the nurses and doctors are doing, but what the nurses and doctors are going through with their families is a part that sometimes people forget. They're human and they have families too. So it was awesome.
An enormously stressful time for everybody. I want to ask this, follow up on that question a little bit with Elizabeth and Melinda. You allowed us in, and we appreciate that very much, to some of the more private moments in your lives. Struggles with childcare, the wait for test results, the isolation from family members. What did you, when those things were happening, did you think we were going to be witnessing those moments? Did you worry at all about whether or not that was revealing too much? Did you want people to understand just how difficult this was for people at home? Elizabeth, you started to touch on that a little bit.
Yeah. I mean, I think honestly, at first, a lot of it was, in all honesty, I was like, oh my God, I need to say the right thing. I can't say the wrong thing. It got to a point though that you kind of forgot that you were having anybody watching you, and looking back at it now after the project is done, it took me back to that place, and it felt even more real than it did at that moment. Those moments were things that I think I blocked out, and I kind of relived it watching these episodes. And I'm sure everyone here can agree that these are things that we probably didn't want to relive, but it kind of made it feel like it was a story that needed the world to see. And I'm glad that they got to see how hard it was for us, and it kind of show how human these doctors and nurses are.
Melinda, you also have been through that same situation. And again, the families are not, there are lots of, signs in front yards thanking our healthcare heroes and all that, but the families are behind them. You were also in that position. How was that for you?
It was
We were very lucky with our family situation in that we were, how to say it? We had, we have like a beautiful home. We have a beautiful community. We basically just took everything a day at a time. Our children were sort of at an age, in a sense, in a good age to be at home all the time. Like our son was a year old, our daughter was 4 at the time, and they didn't really know what was going on. So they had a lot of fun at home, having all the attention from myself. And at the time, my husband's brother was staying with us, so he is awesome with children. So they had a really good time with him as well. So we didn't have any major drama, with, of course, the exception, excuse me, of, supporting my husband with all the stress that he was going through. But in terms of our daily life, we were very lucky in that we were able to, go to the pool, go walk around in our neighborhood, which is on an island, so it was very secluded. So in terms of that, we just sort of took it a day at a time, and we were quite fortunate.
Could I actually jump in real quick for a second?
Please.
Because I wanted to say that it is absolutely correct that when I started this, it was supposed to be like a month-long project. That's what I pitched to Jackson. And I don't know that anyone could have anticipated where this story went. I certainly never anticipated Elizabeth testing positive for COVID more than once. And I think we all kind of knew that there was a possibility that Miami would become a hotspot, but I did not anticipate Miami becoming the epicenter of COVID-19 over the summer. So the story definitely took a lot of twists and turns that I did not anticipate. And everyone was so gracious about kind of just continuing the journey with me and continuing to work with me as I asked for more permission to film more things and come back over to your house again and film this and that. And it was a longer process than any of us thought it was going to be, but they were all really amazingly great about letting me continue to tell this very important story.
And let's follow up on, I'm sorry. Go ahead.
I agree. She didn't plan on being a part of our life for 6 months. She wanted it to be a month, but then Elizabeth had COVID, and then it turned out to be fake COVID, and then she had real COVID. We all had COVID, and then we didn't have a surge, and then we had a bigger surge, and the story actually just kept growing, and she really couldn't find any way to end it until the vaccines came out, and so it really wasn't Reshma's fault. She did plan on just 1 month, and I did get Julio involved simply because I needed someone to make me look good.
Well, let me follow up on that with you, Andrew. So as part of this, you agreed to actually get us video from inside the COVID unit. That's one of the things that makes this such an extraordinary piece, that we actually, as the audience, get to see from the perspective of a doctor or a nurse what it was like in some of those incredibly difficult weeks and months. How did you decide what to film? What were your parameters? And you were using your iPhone or your phone, I believe, and you had to send that footage to Reshma after the fact. So tell us a little bit about how you arrived at what you did.
So I'm lucky in that I get to be the boss of a good number of nurses and nurse practitioners and PAs, and I get to tell them, turn your camera on and film me, and they have to do what I say. The majority of what was filmed was done on other people's phones, and then I would have them send it to me. So they did most of the work. I just had to tell them to do it. That was very lucky for me.
How did you decide what you would film? And were there moments when you decided that's not something we should be filming? We obviously had gotten permission from the hospital as long as we used, footage that was not going to reveal someone's identity, without their permission. But still, you must have had some moments where you thought that's too much, or I don't want to put that onto video.
My only stipulation with Reshma was that she would promise me to blur out names and faces. Otherwise, I didn't hold anything back. Every video I got, I gave to her. I didn't want to censor any of this. I didn't want to censor the pain. I didn't want to censor what people went through. The fact that COVID is still believed to be a scamdemic by many people said to me that if I was to hold back in any way videos, that wouldn't be fair. So any video I got, even if I didn't film it, even if I wasn't in it, and anyone else sent it to me, because I let the word go, be known to everybody. We're doing this documentary. If you have any film, send it to me, and depending on what it is, it may be used. So I was getting film from everybody, and I think I looked the other day, and I think I sent Reshma over 250 videos. I don't know if she has the exact number, but it was something, some huge number like that. But I didn't censor at all. I didn't want to.
And
I also just want to add real quick that I was so grateful that Andrew did that, because I think stories and documentaries are only as powerful as the access that we get and the content that we get. And he was sending me videos almost every night, especially over the summer. And the things that I was seeing, I was like sometimes horrified by, honestly. And, it reinforced to me that like, we need to show the world this, like people need to see what's going on inside the hospital. So I was very grateful that he didn't censor any of that stuff. And also he definitely got really long lists of requests initially. And I had to sort of tamp that down and only give him like 3 requests a day. And then it worked out pretty well. So, but yeah, I was just very grateful for that.
And there are some difficult things to watch in those videos, even what you ended up using. There is there are some very painful scenes, and most people that I know who have seen it have said every episode has made them cry, but also has made them laugh a little bit. And that's something, Andrew, I think that is coming mostly from you. You have a tendency to use some humor along the way, I think. As part of your leading of the ICU, maybe some morale building. Can you talk about that a little bit? Is that something that you consciously do?
Yeah, I think people need to enjoy their job, their work, and that's obviously a very difficult task during COVID because it was a very painful time. But everybody has to remember that they did this job for a reason, and they did it because they enjoy the job. And enjoying yourself and having a good time when it's appropriate, there's nothing wrong with that. And I could tell, and this is why we went with Julio, that we would have a good balance of humor coming from me and emotion and crying coming from him. And I thought that it was really important to balance both. But I do believe life is about the pursuit of happiness. And when you're happy, you're laughing, you're smiling. That's what we do. And there's no reason you can't focus at work, but also make sure everybody has a little bit of fun so that they go home and want to come back the next day.
And Julio, I'd like to go to you now. I don't know if you would like to react to that, but I do have a question for you. But maybe you'd like to address what Andrew said first.
No, I mean, I've been getting kind of ragged on by him for the crying, but I mean, on the video, he said he couldn't live without me. It's a little worrisome.
That was very creative editing. How Reshma could just.
No. I have to say that Julio and Elizabeth are like kind of the heart of this story. I mean, everyone has an important role to play. Certainly, every single person in this documentary. But the way that you guys let me into your lives, and the way that you were honest with me about how all of this felt, is part of the reason why I think this series is so important and so compelling and so powerful, because you represent so many people who are dealing with, if not the same exact thing, like very similar, impossible challenges during this pandemic. So I think the crying was worth it, in my opinion.
Thank you, Reshma. I appreciate it.
Sure.
And that actually leads me to my next question for Julio. We see in the documentary in the beginning that you made a very difficult choice to go and live away from your family, first in a hotel and then in an apartment, for their safety. Why did you think that was the best decision? What challenges did you face while you were living away from your family?
The reason why I made the decision was I think my daughter was 1 when it happened, and we were dealing. I mean, me and Elizabeth had the conversation about me possibly leaving the house just because I volunteered to always be in the COVID unit taking care of COVID positive patients in the ICU. And my daughter had a fever one night that I got home. It was actually one of the nights that I had gotten exposed. She started having a fever, so I was tossing and turning all night. I couldn't sleep. Came the next day, I couldn't concentrate, just worried about whether she was positive or not. So I think it was more for like my sanity. Reality kind of hit as soon as she got that, and to possibly think that my 1-year-old daughter could get infected because of me was something that I couldn't live with. So that was the reason why we made the decision for me to move. And it was definitely missing my kids and my family, like my wife, and it was hard. You get used to seeing them every day, putting them in bed, bathing them, and now all of a sudden that's all gone. You're sitting down at a dinner table by yourself. We eat dinner together every day. So like just being away from them in general, not being able to hug my kids and my wife, it was really hard. I think that was the hardest part of everything.
And there comes a moment for you and Elizabeth when your worst fears come true, that neither one of you are able to be with your children for a while, for safety reasons, of course. What was that like for both of you, and how did you manage that? That was a difficult moment. Maybe Julio, do you want to start?
I'm sorry, can you repeat the question? Sorry, I couldn't hear you.
That's okay. The moment when the two of you, neither one of you were able to be with your children, and you had to both be separate from them. What was, that was a difficult time. That was the thing that you were most fearful of. How did you manage that? What was that like for you?
I think I wasn't, I mean, I don't think I was that much in fear because they were staying with my mom, and, my mom's, she raised me and she did a pretty good job. So I wasn't really too worried about the kids being with my mom. And I knew that I would be able to come home whenever I would finish, like 3-4 days in a row, whatever I was doing that week. I would get tested, and if it was negative, I would go home and be able to see them. During that time, I was honestly more concerned about my wife, the testing, the positive, the symptoms, how she was doing mentally being away from the kids, because she's never even been, I think the max we've been away from the kids is maybe a day. Me and her take a romantic date. So I was more concerned about her than I was about not being with the kids all the time at that point.
And Elizabeth, maybe you could talk about that from your perspective.
Yeah. I don't think it was so much them being with my mother-in-law or anything like that. I think it was more me not being there, and me dealing with me not being there, and knowing that he's not there with them. Like, that was just like, no, no. And I saw that scene and I felt really bad after I saw it. Like, I came off, I told my husband, I'm like, wow, I look like a jerk. But, I didn't not want, anyone else to get exposed. That wasn't the thing. It's not that I didn't care that anyone else was exposed or anything like that. I think it was just my own, like, internal battle of, like, I feel like I'm abandoning my kids, and now my husband is leaving, and I'm like, you're abandoning them too. And it was so many emotions going on. I think, that was probably one of the biggest stress we've had in our marriage ever. And, I'm glad that it's just over with.
But it was something that I'm sure you were not alone in. Many families have been struggling with this sort of thing. But you were able to overcome it with no real difficulty, right? So today you're all back together again. You're in your home. Obviously, you have one exposure that you have to think about now, but in general, you've gotten past that point. That's right.
Yes. I think it's just a sign of the times. I think we're going to be exposed, and we're going to have to be dealing with this for a while. So I think it was very fresh when that happened. That's when COVID first started. The numbers were crazy. People were dying left and right. We didn't know how to handle this. We didn't know what to do. And we just said, get the kids out, just get them out. Now I think we can handle it a little differently. The tests are coming back a lot faster. If I need to stay upstairs, they can stay downstairs. I'll wear my mask. We know kind of what to do. Back then it was pretty scary. We had no idea what was going on.
And the process you went through with the testing and the results and the lack of results, and that, as you say, has gotten much better over time. But that was a very difficult thing for you too, to wonder and not be sure if you were exposing your family, right?
Yeah. Which I actually have to say a big thank you to Dr. Andrew, because a lot of us getting tested and getting our results and annoying him every 5 minutes, that's something that I don't think a lot of people had, and we were very blessed that he was able to be there for us during that time.
So I wanted to move on a little bit. There was another person that was featured in the documentary, Diane Washington, who could not be with us today. She's a woman of incredible strength and courage. I think we probably all agree. She lost both her son and then her husband to COVID early in the pandemic. Both of those men, her son, Derek Bernard Sharpley, and her husband, Kenneth Washington, a pastor in a local church in Miami, were patients at Jackson South. In fact, the 1-year anniversary of Kenneth Washington's death is this week. For Andrew and Julio, Kenneth Washington's death was particularly difficult for you. Could you talk to us about that if it's not too difficult? Andrew, maybe you'd like to start?
It is kind of difficult. It's very hard to process death at this level. And one of the obvious defense mechanisms we do is we try not to focus on the humanity of it. We try to become scientists and really be very focused on the science of what we're doing, and not realize and not really get into depth about the history of the family, the history of the patient, because it just becomes overwhelming. And that was probably the most difficult part about watching this documentary, was really getting to know these patients in that way, because one of the hardest things about this COVID thing has been second guessing everything we've done. The things that we've done in the beginning are not the things we're doing now. And so there hasn't been a patient where I haven't wondered a month later, we're going to be doing this differently. And is it because of what we did that this patient isn't here anymore? So it is difficult to talk about. It is difficult to really understand the humanity behind these patients, because this is just so hard on the medical community. A disease like this it's just not the norm. I deal with death every day in the ICU, and actually, it's one of the better things that we're good at is helping families understand when it is time to let people go, not to keep fighting, and we do that daily, and it's understandable. It's part of life. So when it's the person's time, we can live with it. But all of COVID has been patients who it wasn't their time. So every single one of these deaths have been very difficult. Prior to COVID, I think I knew about 10 of my patients that died on me in my career that shouldn't have. And now it's 300. So the humanity part of it is hard.
Yeah, you spoke in the documentary a bit about the heavy emotional toll of giving people terrible news over and over. And you said it was compounded by the fact that you weren't able to let their loved ones into the hospital. At one point you said it was hard when they yelled at you and it was harder when they thanked you. Could you expand on that a little bit?
When the families are here every day and they see what you're doing, you discuss your plan, and the families understand what we're doing, and then they see it fail because everything we do doesn't always work. They can understand that better. They understand that we were trying. They can see it in our faces. They understand when things go wrong and we rush into the room and do everything we can. But when they're not here, and there are a lot of patients, and they're not getting updated the same way they would as if they were here. Then they're left in the dark, unfortunately, and because we have so many patients, we're only making phone calls when they have to be made. So that connection with the family member is not made. And so then when it goes bad, which because of COVID, it went bad a lot, that lack of connection and the frustration on the patient's part obviously will turn to anger on their end. And it's understandable. It's just a very difficult thing because it's not that we didn't try. It's just the family doesn't know how hard we tried and they didn't see it. And then on the other hand, when they thank you, but you didn't succeed with the outcome that you wanted, obviously that's nicer than getting yelled at. But again, every single one of these deaths, we're going to wonder at some point, what's the hydroxychloroquine? Was it the early intubation? Was it the delayed intubation that we're now delaying intubation longer? So that second guessing is going to go on for a long time. And yeah, I think it's just a personal thing that I don't like to be thanked when I didn't get the result I wanted.
And Julio, you were also there for all of this. Again, I know it's difficult to talk about, but if you could tell us a little bit about what that was like for you, did you also feel that level of emotional pain and the toll it took on you personally to be there for so many people losing their lives?
It definitely was. One of the hardest things about actually being able to watch these episodes is like watching Miss Washington, and seeing her son and her husband there, alive in pictures and videos. And like Andrew said, I like her saying thank you to the nurses and the doctors and the healthcare workers. I don't know, it feels kind of weird because we didn't succeed at what we were trying to do, which was get her family back together, and seeing her alone in the house and stuff. It's kind of tough to watch that. It doesn't make me feel any better. Like Andrew said, unfortunately in the ICU we do deal with a lot of deaths, but with COVID it got really rough. There was one shift, I think, we went down to the morgue like 5 times in 12 hours. But you just, like Andrew said, the way we play it off is like kind of, all right, what else is left in the ER? Who else can we bring up to try to, help out or try to save their life, and keep moving on? Because if you sit back and you think about it, I mean, you can go into a real deep hole.
Well, when no healthcare worker, I think, ever signed up to be a healthcare worker in a pandemic. So certainly that was something that nobody could have anticipated. But when you look back at it now, in that time period, Julio, do you feel as though that was that better days are ahead, and that you're on the right track here now? We are in the United States. Do you think there's some? Do you feel as though science has advanced because of these situations?
Yeah, definitely. I think we're headed in the right direction. At least here in the hospital, we're not as full anymore with COVID patients. They're not as sick as the beginning when we first started getting COVID. I think science has advanced a lot, and like Dr. Andrew said, we're delaying intubation. I actually think that's saving lives. The hydrochloroquine, we stopped using it. Saw a lot of negative side effects towards that also. The vaccines. So yeah, I definitely do think that we're headed in the right direction, and you can tell by the admissions that we're getting, the amount of COVID patients that we're getting, it's not nearly as much as we used to before, and people are definitely not as sick.
And that, Andrew, that also brings up a little bit of a question that we do see in the documentary, the arc of the changing medical practices. It's a little jarring for me, and maybe for others, to hear about hydrochloroquine at the beginning, because you actually had some of that, right? You took some of that as part of a treatment. How have you seen things change, and when you look back on it now, what do you think of the way, from the start to today? You get some perspective from looking at that documentary?
Yeah, but not necessarily good perspective. It hurts, or it's hard to swallow what we were doing in the beginning, compared to what we're doing now, and to think that could have considerably added to some of the morbidity and mortality is a hard thing to watch, because the one thing about being a doctor is that we're not testing new things out. That's not what we do. We do tried and true evidence-based medicine. So everything that I do in my practice is because the researchers figured out that this is the best thing. Literature has supported, repeat studies have supported that this is what works in this situation most of the time, the best option. We're not just trying to figure it out at the bedside. That's a very different person who's doing those kinds of experiments. And I didn't sign up to be that kind of, let me just test stuff out and try things just because a few people have said it. And to know now that could have contributed in some way, or possibly contributed to some of the morbidity and mortality, it's tough to think about, because we have our algorithms and we trust in our algorithms, but our algorithms were wrong because we didn't have enough information. It's tough, and I don't like to think about it.
But how has treatment changed, though, in that time?
Say again?
How has treatment changed in this time, though?
So obviously the hydroxychloroquine everybody knows about. That was a big thing we were doing right away. What we weren't doing right away was focusing on blood thinners and clots. We changed that when we started seeing actually the blood clotting in the dialysis machines. And there was a focus on intubating patients very early, so it could be done in a controlled manner that would minimize exposure to the staff. So we were actually monitoring every hour, every COVID patient for their oxygen requirements, the respiratory rate. And when we started to see a decline, the patient would get intubated early in a controlled fashion. We then started seeing some very grim numbers with all of the intubations. And so we have now switched to trying to avoid intubation for as long as possible, including keeping people on non-invasive ventilators with masks that are really tight on the face for up to 30 days in hopes of avoiding the intubation. So it has really changed. We've had remdesivir for a long time, but now we're only using it in certain people. We were giving it to everyone at some point. There have been a lot of things about our approach to the patient that has changed as well. It was, in the beginning, there was definitely a fear of getting involved with the patient. The amount of gear that therapists would wear to get into the room has changed, because now we aren't seeing the transmissions to healthcare workers. We know now that the masks, goggles are working very, very well. And that has allowed us to get more active with the patients, which has also taken time to get comfortable with. So there's been a lot of things that have been done a little differently. And I think one of the things that we'll see, obviously the vaccines have been the number one cause of the cases going down, but we're going to see more of these Regeneron, more treatments that will help with COVID later, because these treatments will have been studied properly. Jackson South was actually part of University of Miami stem cell study. We enrolled a few patients from Jackson South, and we're going to be doing a phase 3 trial, but the patients who got the stem cells, 96% recovered. So there is going to be therapies that are going to come out of this. that we'll know work and will give us better confidence next time.
Yeah, that's encouraging. And as you say, there are a lot of things in the works. But you guys were there, at the basically the hardest time. I did see that Julio and Andrew, you got to know each other quite well during this pandemic. There seems to be some bonding that went on, at least according to our documentary. Julio, could you talk a little bit about that? How do the two of you work together in the ICU? Is that how this works? And then you knew each other because of the documentary, or how did that happen?
No, I've been working with Andrew already for a little bit. But yeah, definitely with the documentary, I think it was more of a personal level. I don't know. Yeah, I mean, it was more like I guess a little bit more personal. Especially when like Elizabeth tested positive for the COVID. My kids came in and got swabs, and he definitely helped us out with that. I think what won him over though was that I sent him a couple of tomahawk steaks over to his house. Ever since then, he completely changed with me. He's been really nice.
I'm waiting for more. Actually, I remember when we were testing Julio's kids, this was horrible because those kids did not want to get tested. And at one point, Julio was like, "Will you hold them down?" And I said, "No, I'm not holding your kid, manhandling your kid while somebody shoves a thing in his nose." But I think Julio and I are in a very similar situation with our families, young kids at home, and I think we've been bonding over a few years, a lot of similarities in sports, and so we were already friends. And if you give me some tomahawk steaks, that will bring you ever closer to me.
And I gather that you all participated in some sort of a race together recently.
I saw the pictures; they look amazing.
We participated. Andrew was taking off his shoes because he didn't want to get his feet wet.
Yeah, we are Spartans now, and it was probably because of COVID that we all at the hospital. It was a few of us from the hospital that did it. We're vaccinated. We feel safe, but and I did take my shoes off because I don't like wet socks. Socks are not meant to be wet. That's a normal thing. But we as a group outside of the hospital are also engaged.
And the documentary was shot as COVID numbers went down, and then they went back up again in the summer. When you see that now in retrospect, what were your fears about the surges, and then when it abated and then it surged again? Julio, maybe you could start.
I mean, when it came back up, my number one. I was like, I can't leave my house again. It was something that you're like, the first one was nothing compared to the second one, and now I'm still at home. Then it was, is this thing ever gonna go away? Is this something that's like gonna happen up and down forever? So you start getting a little concerned. I mean, but at that point, it's like you don't know what else to do. You try to keep everything the same and just keep going. I mean, there's not much you can do after that. After that first wave, we were just machines by the second time around.
You just showed up for work every day and knew what you had to do and kept going?
Yeah, pretty much. I mean, that's the way you got to take it. You weren't going to start all over again, leaving your house and doing all the stuff. So, just try to stay as safe as possible. My wife tested positive. I wasn't even, and I didn't. So now I knew that that what I was doing at work was working for me not to get infected. And like or with our administration, they definitely got us all the PPE, all the masks. We had also all the supplies we needed. We were never short. So I was able to stay safe. So I didn't really consider leaving again the second surge around.
And Andrew, you were, obviously with your view of the ICU as a whole, you monitoring that very carefully. What did you think when it, there's some discussions in the documentary where you talk about, things are better, then things are getting worse. What was your thought pattern on that? Did you think this will be a surge and then come back down? Were you worried we will never get out of this? Did that ever cross your mind?
So when we had our biggest surge, this is a 200-bed hospital, which includes the OB beds, the 30 ER beds, psych beds. When we were at our biggest surge, we had 114 COVID positive patients in the hospital, and we had only one area, 24 beds of non-COVID patients, and it just seemed like we were going to have to open up a field hospital any day now. But what came of that, or what turned that around, actually was the knowledge, which we didn't have throughout from the first surge or the actual huge surge, was that patients would be considered not infectious after 10 days if they were afebrile for the last 3. So what we had in our hospital, which made it so overwhelming because of how we had to open up other areas, was we had patients that were just sitting there that we didn't know were no longer infectious. We were waiting for the nasal swab to turn negative before nursing homes and rehabs were waiting for that on patients who were asymptomatic. But the nasal swab, we now know, can be positive weeks or months after. So we don't do that anymore. And that was really when the surge started to die down, is when we had that knowledge and we were able to start saying, no, the patient is now no longer infectious. So we were able to discharge a lot easier. And then this surge was about the ICU and the capacity in the ICUs and the COVID infectious floors. And it got to be a lot more manageable from that standpoint. We had our treatment therapies down with plasma and everything we were doing with the medications. And we were focusing on lengths of stay. When did the patient get turn positive initially, so that we could downgrade them from isolation, which then made our 115 COVID positive patients all of a sudden go to 30 because most of them were not infectious. And then that number just kind of plateaued for a while. And today we're at 15 with actually 0 ventilated COVID patients right now today.
That must be a big relief to be able to say that. And you, in that time, you were watching the numbers go up and down. But did you ever believe that that it would be all the way gone, or are you still thinking that we're going to be able to live with this for a long time?
I said early on to someone that the only thing that has ever really been effective against viruses are vaccines. We know that works very well. When we vaccinated everyone with polio is not around anymore. Measles disappeared until the anti-vaxxers came around. So vaccine was going to be the way out of this. And we have that now. So we are now seeing the numbers going down. However, the numbers needed to be vaccinated in order to get the number to 0 is probably not a number we're going to get to. So I don't think we're going to ever see it go away, because there are too many people, anti-vaxxers, but also people believe in vaccines, just don't believe in this vaccine yet, who aren't going to get the vaccine. And so the numbers aren't going to go down to 0. So COVID is probably going to be around for a long time because we're not going to get the herd immunity that we need.
But we know a lot more now about how to treat it, and hopefully those treatments will get better. I want to direct a question to Melinda and Elizabeth. When you were looking at this documentary, I'm sure there were some things that that you didn't remember, as you said. But also, were there anything that surprised you? Was there something that you learned about your own family or your husband that you didn't actually know until you saw this? How they handled the pandemic. You don't see them at work normally. So, Melinda, maybe you could start.
Sure. It's interesting because I've worked in hospitals as an occupational therapist and in an ICU as well, briefly. And so I do know what my husband does, but watching the documentary and actually seeing him in action, and seeing him having to make all those hard phone calls, just Like he's like a really amazing guy. I never really told him that.
Yeah.
I don't know why I'm getting emotional, but yeah, like I already knew he was like a great husband and a great doctor, but just watching that, like, and that's one of the reasons why I got emotional, watching the documentary, because what he does is just really amazing, and I'm very lucky.
And yeah, that's something that we really wanted people to understand. It's the reason we did this. And Elizabeth, would you like to tackle that question?
Yeah. I've never worked in a hospital. I had no idea what he did on a day-to-day basis. And, I know of a lot of the stories that he would come home, and there's always going to be patients that stick with them, and there's always going to be cases that really affects them, and they bring them home with them. And I've always heard those stories from him, but seeing him in action in those clips and seeing him, it was a really good feeling, because everyone knows that doctors and nurses are heroes right now and everything, but to know that my husband is doing that, and to watch him do it, it was a really cool feeling, and I don't know, a lot of this gave me different perspectives that I never imagined I would ever get a chance to get. I definitely think my husband likes me more than I originally thought he did. I'm his hero and everything. So it helped our relationship a lot. And, it made me appreciate who he is and what he does. And it made me realize that he appreciates me a lot. And I didn't realize that, I think, before this.
Julio and Andrew, is there anything that surprised you from watching this? Either one of you want to jump in?
I was definitely surprised that Elizabeth was Julio's hero and not me. That shook me to the core. I think the documentary is very well done. I made comments over and over when I'm sending all these clips to Reshma. I don't know what you're going to do with this, how you're going to make a story out of this, but she did. I didn't expect my wife to make me emotional. That sucks.
Aw, you have a heart, Andrew. It's okay. It's okay to have a heart.
I think you guys tricked me. I think you guys got together to do this.
We may have.
Julio, would you like to address any of those points?
I just watching the videos. It was like, we're worried about work and stuff, and I understand that everything that we're going through, but just our wives, what they're dealing with, while we're here 14, 13 hours, out of a day, and they're with the kids cooking, making sure that they have breakfast, lunch, and dinner. I mean, I did it for 2 weeks that Elizabeth was quarantined, and I almost checked myself into the psych ward. So just Melinda and Elizabeth, thank you for what you guys do. Thank you for being there for the kids. This documentary definitely made me realize that. And Rishma, you were supposed to edit out the part of Elizabeth being my hero, but that's okay. I forgive you for that one.
That's our Spartan team name next year. Elizabeth is my hero too.
That's such a good idea. Can I jump in really quick? First of all, this is so amazing that you guys learned stuff about each other through the documentary. That makes me really happy. But obviously, I made this documentary for many reasons. The main one being that there are still people who believe that COVID-19 is not real. I know people who believe that this is all a scam and none of it's real and no one's actually getting sick. And I think Andrew actually read one of the comments on one of the videos where someone wrote that these must be paid actors. How much did you pay them? And I really want to set the record straight that no one was paid. These are not actors. These are real people who went through real things, who allowed me to be a huge pain and film everything they were going through, even really hard stuff. And that this pandemic is very much real. So I hope people actually believe that when they watch this. Yeah, because none of this was fake. None of this was planned. I heard Andrew say that it was really tough to look at the beginning of the series about how they were treating the patients and because they know so much now. But I think that's part of the value of a documentary like this is a novel virus. I mean, no one knew anything about this virus, and people are still learning, and we're still catching up with testing, and things have certainly improved, but it makes sense that no one kind of knew what they were doing because it was a singular moment in history. So I think documenting that is very important and valuable. And the last thing I will say is that, Elizabeth, you did not come off as a jerk during that moment with Julio, because I think the nature of this pandemic is that it was impossible. People were put in impossible situations, right? What is the right answer to either, as you said, abandoning your kids or potentially exposing people to COVID-19? What is the right answer to that? I don't know that anyone will ever have the right answer to that. So I think you guys really just humanized this entire experience. And I am very grateful to all of you for that. Yeah.
And we basically have about 1 more minute left. So I really would like to very quickly ask the 4 of you what you would like to have people take away from seeing this. And maybe Elizabeth, since we've been talking about you, you could start.
I think what I want everyone to take away from this is just remember that, when you do go to hospitals and you do come in contact with doctors and nurses and everyone around you, know that they have families too, and they're doing everything they can, putting their own personal lives aside to save you and to do the best for you. And that's huge. I mean, that's literally what a hero is, and it's amazing that we actually come in contact with these people on a regular basis, and a lot of people don't, I think, appreciate that.
Thank you. Melinda, could you address that too?
Sure, I agree with exactly what Elizabeth has said, but also to encourage people to get vaccinated, because I'm originally from Canada, and my family and my friends are there, and they don't have the supply that we do, and they are desperate to get vaccinated. So we have this opportunity, and we should take it.
And Julio, could you also tell us what you would like people to take away from this?
Definitely what Rishma said, that, and Andrew was saying, that this COVID is definitely not a scam. It's nothing from the government, all the stuff that people were saying. There's still people getting infected. There is still people getting sick. Like Melinda said, just get vaccinated, and so we can get over this and move on with our lives, get rid of these masks.
And Andrew, we'll give you the final word on that.
Well, having actually received hate mail from people regarding how fake this is, and that I'm not a real doctor or not a real,
Oh my God.
To them, when we're real, you can look us up. None of this was fake. To the families of my patients, just know we tried.
Well, I want to thank our panelists for the conversation, Andrew Pastewski, Melinda Lee, Julio Valido, Elizabeth Valido, and filmmaker Reshma Kripalani. It's been wonderful talking with you. For our audience, if you'd like to watch the documentary, Inside the COVID Unit, Battling the Coronavirus Pandemic in Miami, go to miamiherald.com. Thank you all very much.